This is Dr. Jacome, Bariatric Surgeon from Augusta, Georgia. Today we're going to be talking about diarrhea after weight loss surgery. The first thing that we need to understand is that all the bariatric surgeries work a little bit different. We have several types. One is the sleeve gastrectomy, the gastric bypass, the duodenal switch, and I'm not going to talk right now about the gastric balloon or the gastric band. When it comes to the gastric sleeve, the most common thing that we see is not diarrhea, it's actually constipation. And it's related to the decrease on fluid intake and also the decrease in intake of food. At the very beginning after the surgery, some patients can develop some diarrhea, but that is self-limited. The most important part is to be able to keep hydration. We really do not recommend taking any Imodium unless the diarrhea becomes too frequent or too much and it's difficult to keep hydration. In the long run, what patients can expect is actually constipation. And in those cases, we recommend the patients to increase the liquid intake as well as the use of laxatives as needed. Ideally, you would like to have a bowel movement 2 to 3 times a week. When it comes to the gastric bypass, diarrhea after surgery can be present. Again, it's very self-limited, and the most important part is to remember to drink enough liquids so you don't have trouble with dehydration. In the long run, on the gastric bypass as well, you can expect to have some degree of constipation. Again, it's related to some motility changes, meaning changes in how the bowel moves, also decrease on food intake, as well as decrease in liquid intake. So it's very important to make sure you're drinking plenty of liquids to be able to have regular bowel function. But if at that point you continue to have problems, we also recommend the use of a laxative as needed to make sure you have 2 to 3 bowel movements per week. In the case of the duodenal switch, some patients may develop increased frequency of bowel movements. Normally, you can expect to have maybe 1 or 2 bowel movements a day, which should be soft and pasty, but not necessarily liquid. In the duodenal switch, diarrhea is directly related to what you're actually eating. If you're having meals that are high content of sugar or high content of fat, you can expect a very greasy, loose bowel movement. But if you're having the regular diet, the appropriate diet, and you continue to have diarrhea, you may be having some difficulty with absorption. And in that case, you need to go back to your surgeon, mention this to him because there are medications that can help you with this. Again, in the long run, you should not have constant diarrhea. You could expect to have 1 or 2 pasty, soft bowel movements a day. Thank you for watching. Don't forget to subscribe to our channel. Thank you. Thank you for watching. Thank you.